all of you to the Agarwal Foundation and Queen's Club. Thank you for this invitation. सुमन जी ने मुझसे पूछा था कि आप जो 20 साल बाहर रह चुके, आपके एक्सपीरियंस के बारे में, ऑटिज़म के लिए क्या होता है, थोड़ा बताइए, so that we can then have some ideas of what can be done in India. So I was in UK and New Zealand and Australia for the last 20 years, and now I am working with Rainbow Hospitals for the last 2.5 years. We have a child development unit, and I look after children who are neurodiverse. So there are a few things I just wanted to say. First of all, I think the amount of work that is being done in India by way of foundations like Madhav Foundation is just amazing. It touches my heart that even though in India we do not have a complete government setup for this, the society has started to respond to this huge challenge. Now, in terms of the numbers, like Sumanji had mentioned, the numbers are rising, and the approximate sort of estimate is that it is probably somewhere around 1 in 60 or 70 in India. In US, autism is 1 in 35 kids, which is, in one classroom you can have one child on autism spectrum. Now, this poses a challenge not just in the medical setup where a lot of children are coming for diagnosis, but in schools where education is required, and we need the school and the teachers to be prepared to educate children on autism spectrum. And then once they are 18 and then they are looking at employment and independent living, that's another big piece of work that needs doing. Now, we recently had a big workshop and conference in Rainbow Hospitals, and we looked at a number of these issues which impact the lifespan of a child on the autism spectrum. We had called it Autism Odyssey. So I just want to briefly tell you about what happens in now in the countries that I lived in the past. They are, the Commonwealth, where it is a social medical setup. So it's all sponsored by the government. So with the results that a number of these things are just done by the government. So the first point is about early identification. Now, we heard Dr. Suman talk about that it has to be picked up early. Now, IAP has, the Indian Association of Pediatricians has actually laid down some guidelines of trying to screen for autism at age 9 months and 18 months. So if this is implemented and practiced, we will be able to pick up autism early, but the reality is the pressures of consultation time that happens. Now, abroad, one of the things that used to happen is the health visitors used to visit families up to almost 5 to 6 times up until the age of 4. And that's the time when developmental screens are done. And that's the opportunity for families to talk about, abhi bachcha baat nahi kar raha hai, 18 mahine ho gaye. So those are the opportunities for the families to discuss. So there are about 6 such mandatory checks in where I have spent my last 20 years. So this is something we need to kind of look at. So where we identify early, there are a number of other obstacles as well. Even if mothers feel there is something delayed, there are other factors like denial. There are also factors like the family will reassure, no, it's all okay, he will catch up on time. But autism is different. It is not a normal speech delay, and that is why the awareness and education is important. Now, the second part is therapy. Now, thanks to Madhav Foundation, they are able to support people at different ends of the economic spectrum. But, there are children out there where families need the therapy, and therapy is not cheap. It is expensive. It is, it costs anywhere upwards of 20,000-30,000 per month, and that's a big deal. There is no insurance for therapy. So that's another piece of work that we would need to think about. Now, in A third thing that sort of I found quite useful was post-diagnosis support. When the diagnosis of autism is given, it is a huge impact to the family, to the mother, and to the parents. The support that is needed is not just psychological support, but a great deal of other support that is required. So that is something we need to think about, offering post-diagnosis support. Parents also require training, and there was one program in the UK and the New Zealand where soon after diagnosis, parents are trained, and there are about 4 to 6 modules on autism. And a lot of parent training is being done, but we may need to think about systematizing it for the whole, possibly country. Another important aspect is school. Now, as soon as the child is ready to enter school, a lot of our parents are trying to sort of find out what is the appropriate school placement. So we don't have pathways which are readily available. Do they go to a mainstream school? Do they go to an inclusive school? Do they go to a special school, or are they better homeschooled? So these are the options where abroad a Ministry of Education will help the family choose. And again, this is something we discussed recently, where pathways are required to guide parents what is the appropriate school placement. Now, the other major thing is psychological support for the child and the family. The mental health issues in these children and in the families, there is an overrepresentation, upwards of 30 to 40%. And it is important that these are screened and understood. And one other major thing is what after school. So once the children finish school, what do they do? And so then the questions of employment, independent living, etc. come. Recently, when we did the conference, we did a workshop on career options for our children on the spectrum, employment opportunities, and also independent living, because this is an important thing, and parents have that question: what when he grows big? What is he going to do? What work, and where, and what about living? Who's going to care for this person once we have aged? So these are very important questions which we need to think about. This sort of thinking is taking place. There is a great deal of work which is done by foundations such as this, as well as Action for Autism, which is Delhi-based, and Mumbai-based Forum for Autism, and Shraddha Saburi Foundation in Hyderabad. So I think a lot of energy needs to be put into this, because the number of children that are going to emerge in the next 10 years, where we are going to be facing all this, will increase. So it's important all the stakeholders come together to think and problem solve about this. So I just